achieving the successful fertility outcomes. Please join me in welcoming Sohan Sahu. Our third speaker with us is Bhupendra Sahu. He is an experienced biotechnic engineer and an andrologist. He is leading the internal validation of sperm washing at Subhak. He has helped many doctors set up IUI lab setup, and he is also key in supporting IUI IVF success for doctors. Over to our first speaker for the day.
Thanks so much, Jamie, for your kind words. Good morning, everyone. My name is Sohan Sahu. I hope I'm audible.
Yes, sir, you are audible.
Okay. The video looks. Okay. Okay, yeah. So we keep this as an interactive session rather than webinar. I think that will be more fruitful. Just to make sure, Chandan, is this the participants can interact, can talk, or they are allowed to only chat?
They can.
They can. Okay. Okay. I think that will be better. Jamie, you can go into presentation mode.
Sure, sir. Do you see my screen?
I see your screen, but it's not in presentation mode.
Okay. Where do I click?
You select the enable editing first, and then at the bottom you see.
Okay.
Or you can stop sharing. I do it from my side.
Yes.
You can switch off your camera also, Jamie.
Yes.
Okay. Is my screen visible, Chandan? But not the presentation.
It's visible.
Share. Screen. Okay, what's the problem? Yeah. Okay, we start here.
Yeah.
So okay, so let me switch off the camera. Okay, so today's topic is basically the role of sperm washing in the success of IUI and IVF. And especially in IUI, this is very, very critical because in case of IVF, we have some various other parameters to contribute. But when we talk about IUI especially, the role of sperm washing is very, very critical. So let's understand what exactly is the sperm washing. As per WHO manual, it goes like this: the separation of human spermatozoa from seminal plasma to yield a final preparation containing a high percentage of morphologically normal and motile cells free from debris, non-germ cells, and dead spermatozoa is called sperm washing. So basically, it's the separation of sperm from the ejaculate, if we talk in simple terms. What are various methods of doing sperm washing? So the very basic method is the migration method, the swim up method, where we take the semen sample and over that we make a layer of culture medium, tilt the tube at 45 degree preferably, and we keep it in a temperature close to 37 degree, ideal is 37 degree, and allow these sperms to migrate into the culture medium. So typically it takes between half an hour to 45 minutes, or even it can go beyond that based on the motility and the viscosity of the semen sample. The next is the simple wash, where we take the semen sample, mix the culture medium, and put it into the centrifuge for a calculated time based on the RCF and timing calculation, and centrifuge it. And then the live motile sperm gets settled at the bottom as a pellet, and over that there will be supernatant which will be discarded later. And then this the pellet is resuspended in a buffer or culture medium, and then that is given to the gynecologist for insemination through the cannula. The other method is the density gradient centrifugation, and in fact, among these three, the best method or the default method is the density gradient centrifugation, where we have two different density gradients layer, as you can see here. This is a high density, typically it's a 80%, and over that there is a 40% solution, and over that will come the liquefied semen sample. Typically, it's a two-step process. There is no fixed cycle time as such, because the WHO says that each lab can have their own protocol within the parameters. Basically, let's say the RCF and timing that needs to be adhered as per the WHO guideline, but there is a range given. So as per that, you can have your own protocol. So typically, the step one will be between 15 to 20 minutes in the conventional process, and step two will have 8 to 10 minutes cycle. So here again, after centrifugation, the pellet formation happens, and post that we discard the supernatant. Then for step two, we mix culture medium, again put it back into the centrifuge. Again, so it's basically further purification of the pellet, and then again discard the supernatant. Then it is buffered again and then loaded into the cannula for insemination, or it's given for the further process in IVF. Okay, so the selection of method depends upon two factors. One is the intended procedure, like ICSI, for example. We can go for any method because there we just need few sperms. Ideally, one is enough. So typically, the embryologist will go for simple wash. As Sandeep, you can second on that. So simple wash for ICSI, and then when we talk about IVF or especially IUI, if this sample is not normal, then simple wash or swim up will not be good enough to give us the desired quality or the quantity of the pellet, which we can use for further process. So in that case, density gradient centrifugation becomes very important. And in fact, we can treat that as a default method. So what are the up and downside of various methods? As we can see, simple wash, though the process is very simple, very fast, cost effective, but then again, so it doesn't remove the contaminants, which actually is detrimental, especially. So it's detrimental in case of IVF, IUI, IVF both. So, and then going with the swim up method, swim up is largely dependent upon the motility of the sperm. So if, let's say, the sample has less number of motile sperms, or basically the motility percentage is less, then this is not going to work. Though this does not require the very basic swim up method. So though there are different variants of this process, like pellet swim up and all, but if I talk about the very basic, this has a very limited application. So the very basic swim up method does not require centrifuge itself. Then comes the density gradient. So though the density gradient method requires a little bit more time as compared to the simple wash, and the process is skill oriented, the consumables are a bit costly, but then it's the if I see the cost benefit analysis, risk benefit analysis, so it will always be better to go with density gradient centrifugation. So let's see how this centrifugation or how the washing of sperm happens in the natural process when the natural reproduction is happening. So here there are two things which are important. One is the separation of sperm from the rest, basically the ejaculate, and another very critical factor is the capacitation of the sperm. Basically, by the capacitation process, the sperm gains ability to fertilize the egg. In the natural process, after ejaculation into the vaginal canal, the sperm has to pass through the cervical mucus in the cervix here. So here the process of capacitation happens, and then it further advances into the uterus and then the fallopian tube and then the ampulla region. Let's see how the washing impacts. So I hope everyone understands the need for doing sperm washing. So basically, when we do, so it's not an optional thing as on today. Earlier, in some processes, it was done without sperm washing, but now it's mandatory. There's no option of doing either IUI or IVF without sperm washing, or any ART procedure is not done without sperm washing. So by doing sperm washing, what we achieve is the enhanced sperm quality. Basically, it gets concentrated, and then in the process, since it is removing the contaminants, so it reduces the chances of any kind of infection which may cause, if I talk about IUI, it may cause any infection or contraction of uterus that is avoided when we use wash sperm. And when we are doing sperm washing, when it comes with in contact with media, the capacitation process gets initiated, which in the natural case was happening through in the cervical mucus. So here, when we are doing sperm washing, the capacitation process initiates. And in case of IVF, the chances of fertilization increases when we use the washed sperm. So as again, repeating, there's no option of doing a process without sperm washing. But I'm just trying to highlight how it further improves the chances of success when we are doing right sperm washing. And it also reduces the reactive oxygen stress, basically ROS. And then just in case for the academic interest, if you want to understand what will happen if we use unwashed sperm in case for doing IUI or IVF, then in case of IUI, it will cause uterine contractions, it may cause infection, and the chances of fertilization will be reduced. And similarly, in case of IVF, the culture environment that will get contaminated, and there will be a DNA damage because of ROS. All those will lead into less chances of fertilization and poor embryo development. So what are the key parameters to consider when we are doing sperm washing? So right from the media selection through the final preparation, there are various parameters which we should keep in mind. So talking about the media quality, we should select the trusted make of media. And then when we receive the media, we should make sure that it maintains the cold chain temperature. So basically it needs to be transported within 2 to 8 degree of storage temperature. So typically it is transported in a cold box where the ice packs are put into that. And when we are receiving the parcel, we should always check the condition of the ice packs, whether it is melted or not. If it is melted and the exposure is for more time, so the media actually becomes useless. It will not result into pellet formation, and in fact, all your effort of sperm washing will be wasted. So that's very, very critical that we make sure that we receive it in the right condition. And another factor is the storage of media. Once we receive it in the clinic, we should immediately put that into the refrigerator and make sure that the temperature is between 2 to 8 degrees. So this is a usual temperature of the refrigerator. Even the household refrigerator is like this. So this refrigerator is same as the one which we use for keeping the vaccines and all, which is set at 2 to 8 degrees centigrade. Next in this is when we are planning the procedure, the sperm washing procedure and further process like IUI, IVF, it's very, very critical that we allow enough time for the media to come from the refrigerated temperature to the normal temperature. There are different ways, like we can take out the sperm well in advance before we actually we start the procedure. Like the different manufacturers, they give different recommendations. Like some manufacturers will say take it out 2 hours before or 1 hour before, allow it in proper temperature. Like you should not do this process in a very cold temperature. Like if you are doing it in a air conditioned room where the temperature is kept at 19 degree or somewhere, so that's not advisable. The temperature, the ambient temperature or the working temperature where we are doing the process should be close to 37 degrees. So though we cannot, that ambient temperature cannot be 37 degree always. In that case, either we can use incubator or the warmer to keep the temperature close to 37 degree. And in that case, the timing can be optimized. So in that case, we don't have to put it for 2 hours. So that's very, very critical. If we use the media which has not come to the normal temperature, that will cause thermal shock on the sperms. It's very, very detrimental to his sperm quality, output of this sperm washing process. Then next is the semen sample, how it is collected. So always we should advise the donor or basically the husbands before, in the previous visits, we should educate them that they have to keep abstinence of minimum 2 days. So 2 to 7 days is the minimum abstinence period specified by WHO. So this should be told to the husbands who are going to give the samples. And then the collection should be always in sterile jar, wide mouth collection jar, and we should never use non-sterile jar. And another key point to consider while collecting the sample is the collection should be complete. Like the initial ejaculate are very, very much rich in sperm, so that should not be missed. So all these instructions should be clearly passed on to the donors. And then once the sample is collected, we should put the cap on the collection jar properly, close it, put it in the room temperature, or as we discussed in case of media, this can also be put into 37-degree incubator or warmer so that it gets liquefied, and after liquefaction only we can start the process. Though there can be some instances where the liquefaction doesn't happen, Dr. Sandeep will give his input about how to deal with those kind of samples where the liquefaction don't happen. And then layering, especially when we are talking about density gradient centrifugation. The layering of gradient media is very, very critical. If we don't achieve good quality, precise layering, the separation, the recovery will not be as desired. Next in that is the right centrifugation parameters. So people usually get confused with RPM of the centrifuge, which is not actually true. The different centrifuge in the long back, let's say, there was used to be a standard radius of the centrifuge, because of which there was a practice that we used to recommend certain RPM for the sperm washing process. But now it's not true. There are different centrifuges which has different radiuses. So what will be constant is the RCF value. So WHO gives a recommendation of RCF, not the RPM. So different process like the simple wash or density gradient, it will have different set of centrifugation parameters. So we should calculate the RCF, that is relative centrifugal force. There is a formula so basically it's dependent upon the radius and the RPM of the centrifuge. There is a recommended RCF range between 300 to 500 G for doing sperm washing. So that is applicable for simple wash as well as the density gradient centrifugation. In some cases, it is allowed to go beyond 500 G, so it can be max up to 800 G, not more than that. But we should always try to do the process within 500 G value, because as we go on increasing the G value, that is going to harm the sperm. And last but not the least, the discarding of supernatant from the pellet. So we should carefully discard the supernatant so that the final pellet formation does not have the dead sperm, the contaminants. It's very, very critical. So how should be the ideal sperm washing? So it should be quick, easy, cost effective. It should isolate as much motile sperms as possible. It should not cause sperm damage or non-physiological alterations. Eliminate the dead sperms and other cells, including the leukocytes and bacteria. Eliminate toxic bioactive substances, including reactive oxygen species. Allow processing of larger volume of ejaculates, though when the quantity is higher, we need to split that into number of tubes, so that Dr. Sandeep will give more details about that. And the process should be repeatable and consistent. It should give consistent result. The protocol should be properly defined, standardized, then only we can expect consistent and repeatable results. Okay, now I'll invite Dr. Sandeep, who is the Laboratory Director of IUI IVF Center. Dr. Sandeep, you can take over the stage and share your input. What all are the additional key parameters than what I have talked about earlier? You can elaborate more on that. Over to you, Dr. Sandeep.
Yeah, very good morning to all of you. Yeah, it's good afternoon to all of you.
Good afternoon.
Yeah. So first, you should ensure that the sperm you're getting from patient, it should be in good condition. Like that, it should be on sterile container, and it should be on the proper way. You firstly you should check the sample. Yeah, you should check the sample. It's okay or not. If the sample is incomplete, then advise to patient again, please give another sample. If sample volume is less than 0.5 or 0.2 something like that, then you should advise the patient to give next sample. If sample is around 1 ml, it's okay. Yeah, or if 0.5, it's okay. But if less than 0.5, so you should advise the patient to give another sample firstly. Then after 10 to 15 minutes, you should check the liquefaction. If the liquefaction is not, then you should wait for another 20 to 30 minutes or around 1 hour. Maximum 1 hour is okay. If not sample is liquefied, then you should add the liquefaction media. Then semen should be liquefied. If semen is not liquefied, then it's unable to give proper semen reports, or you can say that we cannot proceed for IUI or washing purpose. First, if you are doing semen washing, it's okay. You can add the media washing media, then you can liquefy the sample. But if you are providing giving a semen report, then it is not possible to dilute the media with washing media. So you should add BR region that is liquefaction media. So then semen will be liquefied, and then you should report that your semen is not liquefied in proper time. Like that, if semen is not liquefied more than 1 hour, you should report your problem with your semen liquefaction. Sometimes many patients reported that the semen liquefaction is not proper way. So you should mention in report. Then in IUI cycle, you should remember that this patient has a problem with semen liquefaction, not another thing. And some patient has another problem like that, they are unable to give sample. So you should ensure that you should provide a separate room or private room so that he can collect the sample. And you can send patient with her wife so that he can provide the proper sample. Some patient unable to give sample in like this small room or in bathroom like. So you should provide a good condition room, private room, so that he can provide the good quality of sample. It also improve the quality of sample if present the sample with her wife. So it's important in parameter. And collection time, it's okay. Between 2 to 7 days is no problem. And one thing is that media should be in 37 degree. And sometimes you take media and check the pH, like that it's not proper way, na? So you should check media's color. Media color will indicate you media is the pH is not 7 or like the 6. Sometimes it's more than 7.5 or 8. So you should check media first. Media is pH is maintained or not. If media pH is not maintained, then all procedure will be not proper way. So first check your media, sample, and all the things, and then your centrifuge also sometimes. Okay. And
thank you so much, Dr. Sandeep. So there can be some cases, Dr. Sandeep, where the liquefaction is not at all happening. Okay.
yes.
So in that case, is it always the case that we abandon the procedure, we cancel the procedure, or
No
we
need.
can?
No need to cancel. Just
Okay.
wait for 10 to 15 minutes, and then you should add media, washing media.
Okay.
Add 1 ml or 0.5 ml washing media. You can put on the liquefied semen sample and mix
Okay.
it, and wait,
Okay.
and then you can start the procedure.
Okay. 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 Thanks. So I would request other participants also to put their questions, so that now the presentation part is over. We can start with question answer. I think that will be more useful, more productive. So whatever queries you have, you can ask me, Dr. Sandeep. Will be happy to answer your queries. And in the meantime, I can also raise some other queries to Dr. Sandeep. In the meantime,
Very good afternoon, Dr. Sandeep. So my
Yes, sir.
question is that if semen sample got not liquefied within 30 minutes, what will
Yeah,
happen?
yeah.
Is there any intent processes there which will help us to liquefy within 30 minutes, or if not got liquefied within 30 minutes, what will happen?
Yeah, first you should check the liquefaction is not in 30 minutes. You should semen should be kept in 37 degrees centigrade, and you should do pipette in and out. If not more than 30 minutes or 45 minutes, then you should add, if you are going to IUI semen preparation, then you should add media, washing media. And if you are presenting semen analysis report, you are giving the reports per patient, so you no need to add the media. You should just report that your semen is not liquefied in 1 hour. Yeah,
Okay,
you should.
okay. Hmm.
Okay,
Okay.
another question from Bharati Ganesh. He's
Sometime
asking,
in and out doing by pipette, then it will liquefy. Yes.
okay, so another question is from Bharati Ganesh, asking the SAT each RCF.
Say that again, Chandan. What's the question?
I think question is not clear. Bharati Ganesh, you can unmute yourself and you can
Please,
ask question.
yeah, please unmute and ask your question.
Yeah, it's a relative centrifugal force, na? It's
But question
Yes,
is not.
sir. Very good
Yeah.
afternoon, sir. In centrifuge, you wrote something as RCF. No, I just
Correct.
want that abbreviation for that.
Okay. So
it's a centrifugal force, na?
Yes, yes.
In how much centrifugation you are doing the process, na?
Yes,
Generally, it's 5,000 RPM. It's 1,500 RPM. It's okay for doing IUI, sample preparation.
Right.
1,500
How many
to
minutes,
1,000.
sir?
Yeah.
How
It's
many minutes?
15 to 20 minutes. If you are doing density gradient, it's 15 to 20 minutes between.
Yeah. So
Okay, sir.
yes. So just to continue on that, so RCF is basically the relative centrifugal force, and it's a formula
Okay.
basically. It's a
Yeah.
formula. I'll
Oh.
share the details. So it's R omega square into 1.118 into 10 raised to power minus 5. Okay. So this RCF, there is a range given by the WHO manual. It says that you can process the semen between 300 to 500 G. So I should know the radius of the machine, and RPM. Definitely there is a setting given, there is a button given with the help of which I can set the RPM, as Dr. Sandeep is saying. Typically the 1500 RPM gives you a parameter close to what is specified in the WHO, but to be very precise and standard, we should know what is the radius of the machine, okay, at which we are placing the tube, and the RPM setting. Okay. So based on that, when we input the radius and the RPM, then we get the G value, and that G value, whatever RPM we are putting, should come within 300 to 500 G. And if you are not, let's say the pellet formation is not happening with that parameter, with the specified time. So timing is again a trial and error, the centrifugation time. Okay. So you, let's say when you are establishing your Andrology lab, you try with different RCF, different the timing based on the viscosity of the sample. Though there is no precise method to measure the viscosity, but we check, we take with the help of pipette, we release it, and we see whether it's going drop by drop or it's going like a thread. So that way we judge whether this is viscous, not viscous, less viscous, or what, and then we select the parameters. Okay, so that's that. So RCF is very critical. Okay, because if we
Okay, sir.
apply more RCF, then you are going to damage the DNA, damage the sperm. And if we are not giving, or let's say if I'm setting low RCF or low RPM, so in that case, the contaminants will not be removed, and then recovery will also not happen. So anyway, that's of no use, and it will take more time. And as we take more time in processing, the other problems come, like your reactive oxygen species, ROS generation, that will increase. Sperms will start dying. So these are actually parallel
Yes, yes.
activities. Sperms die, and in turn, the dead sperms, they release ROS. So that's going to damage the DNA.
Okay.
Okay. So time is also very, very critical. We should try to. So that's why in the ideal process, how it should be, it's mentioned. It should be quick, as soon as possible. WHO says that you process it as soon as possible to get more output or better output. Okay.
Yes, sir. From sample collection, that pre-wash and post-wash, what's the maximum time, sir? From sample
So
collection time to
yeah.
that
So
only.
from sample collection till insemination, if I'm talking about IUI,
Yes,
the
sir.
best practice is within 1 hour it should be inseminated.
Okay, okay.
That's the ideal way.
Because after liquefaction, whenever a patient come and give sample, technician will be very hectic because we have to do that fertility, vitality, everything in that sample, and after that we have to go for this post-wash everything. No.
So the best practice is we should. So I'm assuming that we are not directly going for IUI or IVF. Definitely, there is a analysis, semen analysis done in advance, right? By which we already know the parameters. When we are doing IUI or IVF, okay, that time we are not going to evaluate all semen parameters, sperm parameters. We are going to check just few parameters, right? Like motility, concentration, count, and all. We are not going to check all the parameters. Maybe Dr.
Okay,
Sandeep
sir.
can elaborate
Yes,
more
yes,
on
yes.
that.
Yeah. Yes. You are saying absolutely right. No need to do again these things. Na? It will take more times. Na? So just quick check and then start the procedure.
Right. So
Okay, sir.
it's
And what's the
always
minimum?
advisable. Yeah, please go ahead.
Yeah, sorry to interrupt, sir. You just proceed.
Yeah, so it's always advisable that we have a complete semen analysis report done in advance, not on the
Okay.
procedure day, right?
Okay, sir.
Because
Noted, sir. Noted.
then only because that's the basic requirement, right? Based on the semen analysis, only I am going to decide whether for this couple there will be IUI or IVF or ICSI.
What's the
But
minimum level for to proceed with that sperm wash, minimum sperm count, normal count for this?
No as such parameter, but more than 5 million per ml, you can go for IUI.
Okay, sir. Okay, sir.
so
If less
basically,
than
yeah,
if less than
yeah.
5 million per ml, then you should advise for IVF and ICSI.
Okay, sir. Okay, sir. Noted, sir. Thank you, sir.
Yeah, so basically it's the million motile count which is important. Okay, based on research, it says that though there are some procedures or some research is done even at the level of 2 million motile. I'm talking about motile, okay, not the total count. Okay, what Dr. Sandeep mentioned is the
Yes, sir.
million count. So total motile count, even in some cases 2 million total motile count has also
Yeah,
given
motile count.
result. Okay, so what is important is the calculation of the total motile count is important to decide. So different researches have given different threshold, but at the end of the day, what so you have to take call, right? For example, let's say in previous analysis, you have found the results within the range of IUI, let's say IUI recommendation. But on the procedure day, if you find the count to be less, then that day you cannot switch to IVF, right? Then you have to continue with your IUI. So we have to see the practical aspects also. So maybe Dr. Sandeep
Yes. Yeah, you're saying absolutely right. Then patient advised to do intercourse on the day of IUI, and so it will improve the chance of success actually. Mm.
Sir, I have one more doubt, sir. I have a
Yes.
patient with autoimmune disorder. His DNA fragmentation shows some complaint. So, is he eligible for this IUI IVF technique with
Yeah.
that DNA fragmentation is not good actually?
Okay, it's more than 30 or around 20.
Actually, I forgot that it's more defective only, I think.
Okay. So you can advise by sperm washing minimum. You minimum handling the sample or one thing, one device is there which reduce the good quality of DNA. Actually, I forget the name. Actually, microfluidics device.
Yeah,
Actually,
I
na?
just
Yeah,
asking,
yes,
is
yes.
it reliable that a DNA fragmentation with a single sample? Will it
Yes,
change in future or like that?
yeah, you can advise the patient to give not to do on first sample, advise to do second semen sample. It will less amount of fragmented DNA actually.
Okay, sir. Okay, sir.
So,
So
if
that
I'm getting
possible
your
to
question,
One thing you can add on is that microfluidics device, na, it not doing by microfluidics device, just you used 0.5 or 0.5 ml of semen or 200 microliter of a semen sample and add, and just motile sperm will separate on the device and used for semen analysis. Sorry, IUI purpose.
procedure,
It
procedure.
will reduce DNA fragmentation issue mostly, but its
okay, sir. Okay, sir.
cost is high, na?
Okay, so
Yes, sir.
if I'm getting your question right, so basically your point is in this case, the DNA fragmentation index is very high, right? There are more, uh, there is a high DNA fragmentation in the sample, right?
Hello.
That's the point. And you want to know whether sperm washing can give me desired output to go for IUI IVF. That's the question.
Yes, her question. What
Okay.
he should do now, like
Yeah, Dr. Sandeep, would you like to elaborate more on that? How to handle the what are
yeah.
various options, like there are
Yeah,
whether there are
one
advanced
option
techniques?
is
Yeah,
yes. One option is simple
microfluidic.
processing by
Yeah, yeah,
microfluidics. Na, it
right,
reduces the DNA fragmentation and more things. Na,
right.
it will take less time and give best output for DNA fragmentation. But its cost is something high as compared to
Normal centrifugation process. Yeah,
normal certification process. Na.
yeah.
Device cost is
And
something high,
so,
but
Dr. Sandeep, in cases where the DNA fragmentation index is very high,
yes.
is it advised to go for IUI, or we should go for a better semen preparation method, like advanced method, like the magnetic cell sorting or any other method, which
Yeah.
separates? Yeah.
Microfluidic device is better, but
Okay.
it take less time and provides less DNA fragmented sperms. Na,
Good,
it's
good
good.
quality sperms.
Good
And
question.
in that case, whether will we get enough number of sperms which
Yes.
will allow me to go for IUI, or I have to go for ICSI in that case?
Yeah. Otherwise, if patient is affordable, then advice to go for IVF or ICSI.
Okay. Yeah, so that's very critical, right? That we, so in this particular case, the choice of method also depends upon the affordability of the patient. That's one of the very key points which I forgot to mention. That's also very critical.
Yeah. as per government guideline, you cannot start the IVF before doing in any IVF.
IUI trials,
So
right?
IUI,
Definitely.
IUI
Definitely.
parameter. So
Right,
you
right,
should try 1 or 2 times in IUI, then go for IVF.
right,
If
right, right,
everything is okay, na?
right.
If problem with anything, then you can opt directly IVF. But if problem is not big issues, then first advice to do with IUI.
So,
As per government.
how should be the protocol, Dr. Sandeep? So, let's say some couple, so one couple comes to you, okay?
Yes,
So, you direct in the first semen analysis,
yes,
are
yes.
you checking all the semen parameters, including DNA fragmentation, or you first check some basic checks you do, and then you go for the advanced additional diagnosis, or how it works?
No, no. First visit, you should do normal semen analysis, and then if anything not good, then you should advise for advanced test.
Oh, okay. And what are the key points to look for, which will give me indication that for this patient, I should go for advanced analysis or a higher level of analysis? What are the key parameters which I should look for?
So, if patient is having 2 or 3 miscarriages before the
Okay,
come to clinic, na, then
right.
it
So
might
that
be
is one
reason that
indication. That
yeah,
is one
yeah.
indication, right?
Yes, that may
And
indicate if
oh,
patient is taking too much of smoking, drinking, then
okay,
also affect the DNA quality of sperms. So
okay,
this
okay,
may be another factor. You should not advise every patient to do DNA fragmentation. Na?
okay, okay. And from this semen analysis, the basic semen analysis report, are there any indicators which tells me that you go for higher diagnosis, advanced diagnosis of this patient in the semen, this simple analysis? Are there any indicators?
Yeah, yeah, yeah. Just morphology. If the morphology is not normal,
Okay,
more than the 3 to 4% is okay. But if
okay,
less than 2, then you should advise. You can go for further test like DNA fragmentation issue. No? If morphology is not good, then DNA fragmentation might be higher side.
okay. And in okay, so we have a few more questions from the participants. Chandan, can you run through the questions?
Bas, ठीक.
I believe there is a report which is shared by Ganesh about
Okay.
a patient, and he's
Okay,
asking for your opinion.
Yeah, let me present this.
Yes, sir. We can make a discussion around this.
Yes. Oh, it's taking time, you know. Dr. Sandeep, are you able to see the report?
Yes, yes, yes.
Okay.
Maybe you can zoom in a little bit.
Yeah. So I
ठीक.
hope the report is visible. That okay, the patient's age is 38, abstinence days 2. Okay, lost ejaculate no, liquefaction time 45 minutes, 2 ml volume, opalescent, smell normal, agglutination normal, pH 7.5.
Yeah.
Concentration 12.9 million per ml. Okay. Total number is 26. 26. Okay. 26. Progressive motility 19. Total motility. Okay. DNA fragmentation less than 30. No. Okay. Yes, Dr. Sandeep,
Yes, yes, yes.
what's your view on this? What
Yeah,
should be the
it's
further steps? What's
report
your
saying that
view?
it's a higher DNA fragmentation index, na? It's
Right.
Then motility is also less, na?
Right.
Yes. So, in this case, you can advise to patient go for IVF like that, na?
Okay.
Yes.
So in this is not this case is not eligible for IUI.
Yeah, it's not saying that it's not eligible, but try to go for one IUI because progressive sperms is very less. Then if you can do by like that microfluidics device. If
Okay.
you improve the progressive motility, na, then you can do. But better is go for IVF. It requires generally 10 to 15 motile sperm. It's okay, no problem.
Okay.
Yeah.
So
But if IUI require more motile sperm.
right. So
Yeah.
let's say just going by the discussion. Okay. So this will be put into, or this will go for sperm washing, right? This is because this is my analysis report. So this will
Yeah.
go to sperm washing. So in
Yes.
sperm washing, I'll get the increased motility,
Yes, it
right?
will definitely move.
And all maybe there will be filtration of fragmented or elimination of fragmented DNA sperms. Okay,
Yes.
so meaning I
Minimum.
may get right, I may get good quality or desired quality samples pellet. So
Yes.
so should we try IUI first, maybe 2-3 times, and then
Yeah.
go
Yeah.
for IVF?
Yeah.
Will that not be
One or
good?
two times. Yes. 1 or 2 times. If not good, then move to IVF cycle. No?
Yeah, so
Because
basically, yeah, so just to conclude on this definitely can give, because though the total count is less, but as we
yes.
discussed, like the threshold of 5 million motile count, but actually
Yeah.
if I go by the research, or the higher chances of success will be with more and more, so that's quite obvious, right? More and more total motile count. So the research, some of the researchers say that 10 million motile count, go for IUI. So I think this can definitely give me more than 10 million motile count, and
Yeah.
it's a case of IUI. We can go for IUI, and then if that doesn't work, then we go for IVF. Okay, we take the next question. Okay, any other questions from any other participant?
I have a question.
Yeah, go ahead.
For example, the female partner has a blocked fallopian tube on the left side.
Okay.
Can they still go, and the husband has got a little less sperm motility, but not very abnormal. Can they still go for IUI?
Dr. Sandeep?
Yes. First question. What was the first question? Tube block or I think something else? What I missed the
Fallopian
question.
tube
One
blocked.
tube is blocked. One tube is blocked. Yeah, go ahead,
One
Jamie,
tube,
you can explain.
one tube is blocked, na? No, so you can go for IUI, na? If first you can try the with IUI. If tube is okay, it's if not abnormal, then you can go for IUI because some patient conceive by if one tube is normal, then patients are conceived, na? If not, then go for IVF.
And how many attempts should they go for IUI?
1 or 2, not more than 3, 4. Two, it's 2 or 3 in a more. It's depend on country and what guidelines is in our country is not more than 3 or 4. No, if more than 4, then you can go for IVF.
Okay, thank you, Dr. San.
Yeah.
Okay, so I think we are already overrunning. So any other participant has any questions?
Yes,
No?
sir, regarding this webinar, So what you
Yeah.
suggest to that for swimmers you got some advanced techniques something, no?
Right.
You are promoting some device or something, no? What's our
Yeah.
what
So
is
so we'll come to, yeah. So we take the questions and then we go on the last part of the webinar.
okay, sir. Okay, sir.
Okay. Okay. So if no further questions, then okay. So as we talked about the importance of sperm washing in the success of IUI and IVF, how should an ideal sperm washing be? What all parameters we should consider while doing sperm washing? Okay. So typically, the sperm washing is done with the help of general purpose centrifuge in a normal scenario. So, Dr. Sandeep mentioned about microfluidic, but the practice or the usage of microfluidic, at least in India, is very limited. Even the other methods also, like the magnetic cell sorting and some other glass wool filtration. So all those advanced methods have very limited presence and practicality in Indian scenario. Okay, because again, so if you go for expensive methods, the total cost of procedure will go very high. So not always recommended. Okay. So Subhag Health Tech is a startup working in the field of infertility since 2018 and have developed an automatic sperm washing centrifuge which standardizes the process. It's based on the density gradient centrifugation. It has various advantages over the conventional method of sperm washing. If I compare all the methods, even you take simple wash, swim up, or any method. So this machine processes the sperm in the quickest way possible because the parameters are standardized, validated, and then it has a specialized centrifuge tube which makes the layering process very easy and accurate. And then the centrifugation parameters, the RCF and the timing are programmed, validated as per WHO guideline, so that ensures the maximum recovery possible in the density gradient process. Okay, so because of shortage of time, we'll not be able to show the demonstration of the product. If any one of you are interested, we can schedule a one-on-one call to understand the utility of this machine. So I'll quickly show you over this video. So this is the device which I'm talking about. And this is a specialized tube. As you can see, the conventional tube looks like this. And this is the one, this is patented products from Subhag Health Tech. So this solves your sperm washing problem. Okay, so anyone of you are interested, you can schedule. So Chandan will help with scheduling the one-on-one demonstration for the product. If you have any queries
Can
related to
you
that,
tell me the cost, sir? Cost for this device?
yeah. So in this webinar that cannot be shared. So so that will be shared separately.
Okay, sir. Thank you.
Because this webinar is on the technical discussion of the process and the product. So we can schedule a separate call for that.
Bharti Ganesh, you can drop your number.
Okay, sir.
Contact you separately.
Okay, sir. Thank you.
Okay. Any other participant has any questions? Okay. Okay. So if no more questions, we can conclude. Jamie, final words.
Nothing much, but thank you so much, Dr. Sandeep, Sohan sir, and everyone who are here. With everyone's help, this has been successful. We are looking forward to more of such webinars.
Thank you so much. Thank you, everyone. Thank you, Dr. Sandeep. Thanks, Jamie. Thanks, all the
Have a good day,
participants.
everyone.
Thank you. Bye-bye.
Thank you, sir. Thank you.
Yeah,